Okay, everybody, it's 6:30.
Yeah.
Call the meeting to order.
I'm seeing a lot of
Okay.
that. Makes me feel old.
Roll call.
Here's young.
Dale
For some
Schrader.
days I don't
Here,
feel so young.
excuse us.
Yes.
The meeting has been called to order.
Sorry, didn't hear it. Sorry. Dale Schrader,
Here.
Creed Schumann,
Here.
Dale Olson, Chuck Van Etten,
Here.
John Pettit,
Here.
Boucher, Jen DeVornick, Bill Pearson,
Yes.
Sabrina Dunlap.
Okay, we have a quorum. Was it noticed in the papers?
The meeting has been noticed to the public and news media as required by section 1924 of the Wisconsin statutes.
Thank you. Meeting agenda, any changes? If none, we'll move on. Public comments. Anybody from the public here tonight? Anybody? Move on to LCO liaison.
Approved.
But I
Oh,
don't
don't
have
forget the
enough.
minutes.
I mean, you can approve these. I can actually send them to you, but
Doing.
But otherwise we will be twice next month. Would
Okay,
you
we
prefer?
can do that.
What are 10 minutes?
Would you prefer? Should I send you, we do two next month because I did not attach them and directly email them to Alex and you can put them up.
It's pleasure of the board. Let's do two next month.
Okay.
LCO liaison.
All right, I'm gonna start with the LCO Health Center report. The COVID-19 positive cases have dropped in the past month. In the last 2 weeks, we tested 50 patients and have had only 2 positive cases in one home. Those 2 positive cases will be out of quarantine tomorrow. In the meantime, the LCO Travel Governing Board has dropped the mandated masking requirements for all travel entities. The LCO Health Center has continued to require masks as we are following the CDC guidelines for masking in health centers. Tribal message is regarding dropping mandated masks included a high recommendation for wearing masks. In addition to the CDC guidelines for masking, the LCO Medical Director, Dr. Steve Okay, I always get is concerned about slowing the spread of cold and flu contagions as part of our decision to keeping masks at the health center. We will continue to test for COVID-19 when symptoms occur, quarantine when cases are positive, social distancing, hand wash, sanitizing, and disinfect. We are not past COVID-19, and we're worried about a new variant. The LCO Health Center provides COVID-19 vaccines on Monday through Friday. Anyone wanting an initial COVID-19 vaccine, second dose, or booster, please call the health center at 715-638-51. Schedule your vaccine. Anyone displaying symptoms of COVID-19, please call the health center to schedule your COVID-19 test. Remember, the best way to protect yourself and our community for COVID-19 is to get vaccinated and follow CDC recommendations, including wearing masks within 6 feet of others, not in your own home, within your family, social distance, avoid large gatherings, and wash, sanitize, and disinfect regularly. That was the last report we got from our health center. And I wanted to also acknowledge that we're making efforts to, I mentioned this last time, for more prevention with the addictions that we are seeing in the community. We lost another young tribal member yesterday, and we're continuing to try to help our people who are battling those addictions, and we're trying to educate and use more preventive measures so our people don't fall into that behavior. So tomorrow night we have a drug trends in Indian country conference being held at our convention center from 5 to 8 p.m. Community members are welcome to come as we continue now to come together now that we have safer times now to be able to help educate and prevent what's happening in the community. We do continue with trying to address what we are seeing, and we're trying to build on our programming. We added that second addiction specialist to our clinic and building on our resources and trying to acquire whatever kind of support we can get. We are also still building on our shelters, and that last emergency that we had last weekend with the storm that hit us, we are working on planning our emergency sites, building more for being ready to respond to those kind of conditions. So we're gonna try to get more generators out there in certain spots within the reservation and cots and things that we need, because we don't know, because there's a lot of families without electricity and without heat. And we want to try to have plan in place more to help meet that need if there were rises. So that brought attention to us a little bit more, and so we're trying to build on that also. Everybody's safe. And I know resources that we have now, I'm not sure what else you wanted to add, but the homelessness, we are trying to take care of our people the best we can, and we're still pursuing those ways and try to build on housing so that we can have more housing available for the people.
You could add about our new health center we're looking at.
And we are pursuing a new health center. We are trying to finalize the final location, begin the project now. So we are working on that, and we've outgrown our facility. It's one of the oldest facilities within our region. I don't know if it's national, it could be national too. And we need to, we've grown enough, and we have to build our new health center to meet the needs for our people, and they have more programming and services. So we're right in that process too.
Are you going to, is this going to be an additional building, or are you going to replace the current
It'll
building?
be a new building. The new health center.
So you'll have two buildings?
No, the other one will be used for another need that we have in the community. It'll be a new health center.
Ms. Bennett?
Hi, I would ask, who's in IT there tonight at the table?
Alex?
Alex, can you mute everybody else's mic besides who's speaking? You cannot hear anything that Lorraine said barely because of the shuffling of all the papers and books or computers on the desk. It was it cut in and out every time. So I couldn't understand half of it. So I'm sure on the recording it's going to be on it.
All right, we'll do a little better about keeping a microphone in front of somebody. I can't individually mute the mic.
Okay.
Sorry about that. That was my fault.
No, it's okay. I just, before you guys got any further, so it's just not all the papers and stuff.
Okay. Health and Human Services Board's appointments, I'll be taking, I guess, tomorrow morning.
I don't know, Paul, did you have any other comments on the appointments?
No, other than that, you and Lynn brought it up to me, and I talked to Lynn, and we decided to put it on here because I don't know what you guys are going to do with it. It sounds like you have a plan now.
Yeah, for the appointments, there are some new appointments that are needed. We did run an ad in the paper looking for volunteers for a position or two that are open on this board and some other boards. So after the elections in April, then the new assignments will be made for all the boards. This board does have like 3-year staggered appointments, so it gets a little tricky when the county board is 2-year appointments, but the board's assignments here are 3-year appointments, so things kind of tend to get out of whack sometimes, but the new appointments will be made then in April.
Okay,
Chairman,
yes.
Senior Resource Center,
3D.
we kind of skipped by them.
Did we approve the minutes from before?
We will have them next month, Ms. Pettit.
Thank you.
Senior Resource Center, Joy.
Okay, I'm here. The first thing is our job openings. One of the things that happened today with our Meals on Wheels drivers, we had several people come in and said they were very interested, but they changed their mind because of the price of gas. So now we're dealing with the price of gas. So again, we're still seeking drivers, especially in Hayward. We have 4 routes because a minimum of 65 to 70 plus meals go out every day. So right now, staff is picking up those routes that we can't get covered. Up until this week, we were doing a hot meal Monday, Wednesday, and Friday. Frozen meals were delivered on Monday for Tuesday and Wednesday for Thursday. This week, I only have to pack frozen meals tomorrow for Thursday because we have enough drivers to cover that. So it looks like for the month of March, we'll only have to do frozen meals on Wednesday for Thursday. So we're hoping in April that all of our snowbirds will be back, so that we'll be back on track with having enough Meals on Wheels drivers, because you start going out between 10:30 and 11. Some routes you don't get back until like 1:30. Like, for example, Route 4, when I do Route 4, because I do so many in Hayward, then I go to Sealy, then I cut across 00 and do 77. So that one usually takes me, when I do it, an hour and a half, and some of the other people too. So we are in desperate need, especially for, drivers for the Hayward area. Our other areas are covered because our numbers, aren't as high. When you look back historically, 3 years ago, Hayward only had 2 meal routes. We now have 4. Granted, COVID increased, some of those numbers, but what we've been experiencing the last several months, or maybe the last 6 months, we have get a lot of phone calls from the hospital where people are getting released from the hospital, and the hospital is requesting, Meals on Wheels either temporarily or permanently. So those numbers aren't changing. The state has changed the requirements for Meals on Wheels, so it's not like they have to be homebound anymore. They can't get out or something like that. If they're 60 and over, if they want a meal, they can get a meal now through the home deliver system. So, and more people are being on, programs like iLife and Inclusa, more on Inclusa than they are on iLife. The largest percentage of those programs, it's people that are on Inclusa. We have a few iLife. We still need a bus attendant and a part-time bus driver. Because we don't have that part-time bus driver, our bus now is only running Monday through Thursday, the regular hours from 7:30 to 4, and Fridays only till 1. Otherwise, our bus driver would be over 40, hours a week, and he's also 80 years old. We can't expect any more from him or that bus. So we still need an assistant cook in Exelon to help Jen with the number of meals that she does between Exelon. She also does the home delivered and carry out meals for the winter area. We did just last week get an assistant cook for Chris in Stone Lake. She's thrilled to death that someone that moved to the area that retired and didn't want to retire, wanted something to do, and she's just working out really well for Chris. Winter, we still need a site manager, down there, or someone to volunteer to help get things going. We have a couple different, options and plans that the board is working on, which we haven't finalized at this time. The MOU, I still need to know if the MOU has been signed so that I can sign it, so I can send that on to Bar. Lynn has it, okay. Senior Resource Center bus. Our bus is 9 years old. Just in the last 2 months, we've put close to $8,000 into that bus. And the bus driver came to me today and said, oh, by the way, there's something wrong with the blower. So in the last several weeks, last month, I've been talking with the new transportation person, Nick Smunson, with GWAR. I've talked with the DOT. Karen and I at Nemacoggin Transit are kind of playing telephone tag right now, so I haven't had a chance to talk to her. Our options right now, the DOT has asked that I inform the county that there is a possibility that we might take out a loan for a new bus. We'd use our trust fund money, which right now is around $33,000 that we have in trust, that we can use towards the bus. What we were thinking, I have talked to a couple banks. They're willing to possibly borrow us the money. One of the banks is investigating low interest loans for nonprofits, which we would qualify for. In talking with GWAR and a little farther with the DOT, there is an option of something that we could do that GWAR is looking into, and this is what I'm waiting to talk to Karen about, is that there's a possibility that there are some buses out there in surplus that aren't too old and aren't too bad a shape. So what we could do temporarily is get a newer used bus and use that until we can write the 5310 grant next year that's due this July. And it takes about a year and a half, almost 2 years to get that bus through the 5310. So Nick Munson at GWAR, who's a transportation specialist, suggested that that might be an option for us too, is to use that trust fund money and buy a newer used bus. But I'm waiting to hear from Karen, and Nick was talking to Judy at the Wisconsin Department of Transportation to see if there are any good used buses in surplus out there, because we do need to do something, because we're just, if we ordered a bus, we're still looking at a year and a half to 2 years to get a new bus. So we're putting a lot of money into something that's old and travels a lot of miles. So that's kind of where we're at. The DOT just asked that I make the county aware that these are our options and what we're thinking about for a bus, but nothing has been finalized yet at this time. So hopefully sooner than later. The AFCSP letter, that's the Wisconsin Alzheimer's Family and Caregiver Support Program. 2 years ago, the ADRC, because we had the National Family Caregiver Support Program, they thought it would be a better match for us to do the Alzheimer's Family Caregiver Program because they're similar. The difference is the N, we call it the N and the A over at the Senior Resource Center. The N relates directly to people with Alzheimer's, where the N is people that the N1 is people that are not diagnosed with Alzheimer's or dementia. So it's a little different. Similar services, similar programs, but there's a little bit more money in the A grant. In order for us to fully get the money transferred from the state to the Senior Resource Center and then go under GWAR so we can claim, we need a letter from Health and Human Services or this board saying that you have transferred the AFCSP grant to the Senior Resource Center, so we can send that to them so that we can access that money.
Okay, so who writes the letter?
I would imagine it either could be a combination of Paul and Lori, just a letter stating that the county, the ADRC, the county has transferred the AFCSP grant to the Senior Resource Center, and then that way we can claim the money either through the state, but what we're planning on doing is turning it over to GWAR so then we can claim it with all of our other claims every month from GWAR.
Okay. Who's first?
John, and then Chuck.
Go ahead, Ms. Pettit.
Joey, is there any way that, I know that you're looking to purchase a used vehicle bus, which all of the prices of the automobiles or transportation has gone up. Is there a way that we can contract with the transit that is currently in place to do that and have them do the bus service instead of Hayward having to have a bus?
We do, like, for example, when the bus is down, we do get a bus from them. We just have to, have it filled up when we take it back. The problem is with the Nemacolin Transit, and the difference between us is, Dawn, when we take people grocery shopping, it's not like we take them to the door, drop them off, and come back and get them. The bus driver, the attendant, gets out of the bus, puts the groceries in the thing, helps them take it to the house. We have a little bit more personal service that with Nemacolin Transit, it's we pick you up and drop you off, and that's it. We have more of a specialized transportation. But we do, Nemacolin Transit is, fabulous with us when we need, a bus or we need help. If our bus is full, we call them, they'll take the people on. But we used to years ago, on Mondays when the bus driver was off, there was a driver from Nemacolin Transit that came in and drove the Senior Resource Center bus. I'm sure that, they don't have a lot of drivers, and I know that Karen's always advertising for drivers too. So our seniors are, used to that personalized service that we give.
Go, Chuck, you're up.
With us, which I've been totally against the ARPA funds going to broadband, and everybody knows this. Tom, is this something that we could use the ARPA funds for, to just buy a new bus?
With the changes in the final rules that allow us to claim lost revenue for all of the ARPA funds, we could use those for any governmental purpose. So that would qualify as an eligible expense.
All right, I'd like to make a recommendation that we use ARPA funds to purchase a new bus, be done with this, will be good for the next 10 years. And that then we can bring this to the full board.
It will have to go on the next agenda as a,
Or you can bring it to the full board next Thursday. Did you hear that, Chuck?
I did not.
It's not on the agenda tonight, so we can't do it as an action item. We can't have a motion and second and so forth. But perhaps you could bring it to the full board next Thursday?
So could we maybe delay it a month? There's some paperwork that needs to be done. And depending what comes up at this next county board, there might be ARPA funds used again.
Did you hear that, Chuck?
I think we're going to run into a timeline also that some of us are getting off the board. I don't know if, the timeline is going to, are they talking about using all the ARPA funds? For
I
whatever's
don't know.
coming?
It's a possibility. It depends what the board would do.
But for Mr. Van Etten's purpose, since it's not on the agenda tonight, you couldn't take action, but you could bring it to the board if you had another sponsor. And then there's the rule that it's a 2/3 vote to talk about it at the board. I believe that would be the process if you wanted to get it on the board agenda without it going through committee.
Yeah.
I wholeheartedly agree with Mr. Van Etten that it's a great idea and we've been spending that ARPA money hand over fist. There would be potential for next year to get a grant for half that, the new bus.
There's a potential through the 5310. The grant process starts in July of this year. But the catch is the last 2 years, they've only given out one bus through the whole state. So, I mean, it's kind of like, when John Swizzler was still the person that I contacted through the DOT, now it's Lori Jacobson. He said, "Oh, you got a really good chance, Joey." And he sent me some grants that people have written, but he said, just to let you know that, it's one probably a year. So you're up against, the not last year, but the year before, there was like 20 or so applications sent in. They threw out all but 3 and awarded 1.
I'm generally against not cooking things through committee before it goes to the full board, but Mr. Van Etten is right, and I think we could probably work together, and I would co-sponsor that to get it there because it sounds like something that just needs to be done. The Namacoggin transit buses, you're talking about taking people for groceries, they limit you to 4 bags. 4 bags of groceries. I live by myself, and I bring home more than 4 bags of groceries.
Yeah, we have a lady we took yesterday that had 25 bags of groceries
Yeah.
because it was Marketplace, Walmart, Miller's Market, Feed and Seed, and Walgreens.
So that precludes Namacoggin Transit from their own rules. Lynn, can we do that? If I co-sponsor something with Mr. Van Etten, I can write it up tomorrow and.
Yeah.
And that would be for next Thursday. Do we have we need a dollar amount.
Why don't you talk to Joey about that?
Yeah, it's about 85,000.
The last time I checked, it was 106, but like I said, we have 33.
Okay,
I'll
Mr.
get
Chairman, I got a question.
some numbers.
go ahead. Appreciate it.
Joey, so you would consider using your trust money that you have set aside
We have
then,
to
and
use
then
the trust money.
have to use that.
Mhm.
So then the balance would come of ARPA.
Mhm.
Chuck and Dale, you understand that the balance would
Yeah.
trust? Okay. Yeah, and I would allow that agenda
Right.
sponsored
and-
by these two.
Right now,
Supervisors.
there's little over 33 in there, and just right now, at the end of this month, we have to finish our final for 2021, so there's a possibility there might be some more trust fund money that would go into that 33. We're just at the process right now, Rose and I, getting all of that stuff together, so there's a possibility that there might be more. And I do know that one of our advisory boards has another $3,000 to throw into that, so you're looking at maybe 36, maybe a little, maybe more that we could put in there.
And this is something the Senior Resource Center is required to provide.
Mhm.
Okay. Any more questions for Joey?
Yes, I just have one more. Joey, do you think you could get some bids together for us? Or I think it would be a stronger ask if you had some bids
Okay,
where this was gonna come from.
Okay, Mike, do I talk to you about the process of what the county uses for bids, and then I can get that out right away?
Yeah, I don't know that we need the bids. 'Cause all you're doing is making the commitment to allocate the funds.
Okay.
When they actually go to purchase, we need some pricing. I mean, we need the
Yeah.
basic.
Yeah, I can call,
But the actual.
Karen buys 3 a year.
and I can
We
talk
don't
to
need
Karen.
bids,
I've got a couple calls into Karen, so. yeah.
Okay.
Okay. I will, hopefully I will get some stuff to you before next Thursday. I'm only gonna be in a half a day tomorrow, but I'll start the phone calls tomorrow morning.
So do you need a consensus of the whole committee here, or a couple of you, or
I'm sorry, what?
you need support from all of us, or?
I don't think we do because it's two
You guys
county
go?
board
You
supervisors
guys
that are
go for it.
approaching it to the county board.
Yeah.
But if you don't like it, you should tell us.
No, I
Because I want to
support
hear
it.
from you that you don't like it.
No, I support it. We need that.
I think it will get support.
Does the tribe have their own senior center and stuff?
Yep.
Okay, so this would be,
And our own vehicles.
Yeah.
And speaking of the LCO Senior Center, most of you know that Terrence has gone from LCO. So Rosalie, who took over his position, has taken over Terrence's position on our Senior Recess Center board. So.
Good.
Yeah.
She's just appointed.
Okay. Moving on. Adult long-term care.
All right, Lori Perlick has a report for your review. I'll highlight a couple of things. She said the APS investigations for last year were pretty average for previous years. They're spending a third of their time on guardianship-related activities, which we said is starting to increase. And you also note on here that she said in last year they did a total of 4 guardianships, and already this year we've done 4. We've already had a meeting with the judge and with TJ. Well, no, TJ wasn't there, but to have some continued conversations about how we can monitor this and be most efficient, and also perhaps get some reimbursement for some of that work. And we're also still recruiting for the APS specialist position. We haven't had any applications. She also noted the ADRC of the North is purchasing a new phone system. I don't have the numbers, but I know it's saving considerable money from the other provider that we had. And the new dementia care specialist is just about done with the training. And then she noted some statistics about money brought into the county from the disability benefits specialist and the elder benefits specialist.
Behavioral health.
All right, Alicia submitted a report for your review. It's a lot of the same information. I'll highlight a few things on here. And that is, we've talked about the last several months that the electronic health system we were looking at was not compatible with our programs here. We talked to our state contact person. She was okay to sever the contract with the provider, and whatever money we got for a refund, she recommended that we use that for kids within the CST program to go to summer camp. And so that's what we're going to do. Let's see. And they're also working on updating the Sawyer County Assistance Guide. That's pretty much it for that. Oh, do you want to make one more comment? For the last 2 years, Alicia served as the chair for the NCR CCS quarterly meetings, and her term has run up, and there'll be somebody else taking her place. So to free some time for her.
Child Protective Services.
We have the usual reports. You have the case counts for CPS and also the substitute care report.
Youth Justice.
And youth justice, the usual report. And it's all right now manageable for them.
Economic Support.
Economic support from Shauna White. They're staying consistent with the performance. I will add something I don't think she noted on here. We do have a new economic support services worker, and his name is Mr. Benjamin Dreyer. Benjamin Dreyer. That concludes the economic support report.
Public Health. Julia.
Yeah, so just starting with COVID update, I had written up an update. Things have changed just slightly. And actually, Alex is going to bring up the website. So one of the things I alluded to in the report was that we needed to get some new community or new levels of what high risk would be, medium, and CDC happened to come out with those right after I turned my report into Lynn. So we are in a low status, and what that means, what they're using for new measurements is how many people in the 7-day period are new COVID cases. And it's fewer than 200 per 100,000 or over 200 per 100,000. They take that as the starting point, and then they look at the number of admissions, new COVID admissions to the hospital, and the percent of inpatient beds that are occupied. And the hospitals that feed into our area is Ashland and Hayward. So they look at the two hospitals combined. And with that, then they give us a community level. And right now we are in low. So everything is looking very good. A lot of Wisconsin is turning green. So we're kind of in, and actually a lot of the United States is really yellow into green. So moving in those directions. So why I had Alex bring this up is we have this little diagram here that says, okay, we're low. What are the things that are recommended to do? This is all just taken off of CDC. When we move into medium, it will transition mainly into high-risk people being more aware and wearing masks and watching their locations, and you move into high, and then it would be recommended that everybody would mask indoors. So just getting prepared for that, but that's what is out there. But right now, things are looking good. We are still testing at our site Monday through Friday, but it's about 2 hours a day. We're testing anywhere between 1 and 5 people, so not very many people accessing, and LCM is the same. They're not having very many people access the resources either. So that is my update. Does anybody have any questions on that piece of it?
I do, Mr. Chairman. So Julia, what do? We reached herd immunity then, or the vaccines have taken over, or the virus is just?
It's a combination of natural immunity or acquired immunity and vaccines. And this one, I mean, we really ran it pretty hard in January in our area and across most. So unless we have another variant that picks up, or and we anticipate that would probably be a while, our immunity would start to wane, and then we'd be more vulnerable to maybe a new variant that would come out there. We're still watching to see if additional boosters will be recommended. Probably will be an annual thing like a flu shot. So.
Anybody online?
It was good to hear. I just came from another meeting in within the public school that less and less and less. There was more the staff that they were seeing it with than the kids, which I thought, okay, you know, but it's so much better.
Yeah. And the thing that we're going to continue to do is we do meet regularly with a lot of different agencies and groups related to COVID, but we're all happily transitioning to our next steps and using all these connections to move into the other prevention strategies not related to COVID.
What are you going to do with all your spare time?
We're working on strategic planning and that chip that we brought to you last week, so, or last month.
Okay. Mr. Chairman, I got one more if there's no one else.
Go ahead.
So the unvaccinated folks, did they acquire some immunity through this? Maybe if they came in contact with the virus?
Right. Yep. So they have acquired immunity. So a lot of people have had some COVID at some point. So they have acquired some immunity. So.
Okay. So does that give them any protection going forward then, or will it wane faster than a vaccinated person?
At this point, if you have got Omicron, have a much more immunity or antibodies because that had so many different variants to it versus Delta. So those that got Omicron have a little bit better protection moving forward, at least for right now. I had Delta, not Omicron, so I'm.
Thank you.
Okay, next is the fees.
I have the fee resolution. So Matt and I have been working on the fees. One of the things that we knew we had to look at fees for was the shipping costs went up considerably. The state used to have a contract with UPS. That contract ended, and when they renegotiated, it was quite a bit higher. So we started looking at that. While we were doing that, we just validated the time costs as well. And in the meantime, we also have been working with Round Lake. They want to do a baseline testing to get kind of a feel of what's happening in Round Lake. And as we started looking at what they were looking for, as a township, we started looking at the metals packages, and the metals packages were pretty expensive. Through UW Oshkosh, we were able to come up with a better package through Stevens Point. We do want to keep continuing to use both labs. Oshkosh helps us make sure that we're accredited and doing everything we need to do to keep things in place for the water lab. And then Stevens Point offers some other great things where they'll kind of give us advice on when we want to do some sampling of water and get a baseline, how do we do all of that? So they kind of walk us through all that. So anyways, with that, it's kind of a restructuring in fees, and wanted to bring that forward. Quite a few fees are staying the same, and I'll just kind of walk through each one of the things that we're doing and bring that forward. So bacteria, we were charging 25. We'll continue to keep work at that. Nitrates, we had discontinued that, but it could be something that's an option. So we just wanted it on the fee structure. So adding that one back in. We are keeping, and then same with arsenic, we had taken that off last time. We'd like to add that back in. We'll continue the same pricing in the bacteria nitrate. The homeowners package, we are making an adjustment on, and I'll get to that at the very end. And then we'd like to raise the real estate package up $5 from 100 to 105. And then we would like to remove the metals package that we had from Oshkosh that was 125, and we can add a metals package through UW Stevens Point for $75. So even though some things are going up, some things are going down. And then the last fees that we are looking at is we actually took the homeowners package, which was $70. And we're readjusting that so that we can have a basic package. So we took the arsenic out and we can start everybody at a $55 package, might get people to test a little bit more. And then added the comprehensive package so that then we can use the new metals package from Stevens Point. So that is the kind of the long and the short of it. So this is what we're requesting for fee adjustments.
Do you have any questions, Dale?
I don't have a question. I just wanted to make a motion to approve the new fee schedule with the exception of $105 for the real estate package seems like an odd number. And with the price of real estate right now, which is something I do, I'm thinking something along the lines of 120 or 125 seems a lot more well-rounded. Otherwise, you got to keep all those 10s and 5s on hand to make change. So I think that should be bumped up a little bit, like to $120. And I don't think you're going to find one real estate agent in the area that would quibble a lick. So I would make that a motion. I don't know if we should add something in there about Ms. Lyons saying that UW Stevens Point was a better college.
I do have one thing I just want to say on that real estate. We do tend to really use that for people that have VA loans. So even with that, you're good. Okay, I just want to make sure that people are trying to get in and get housing. So, but if I'll leave that to everybody else here.
Well, will this new fee schedule, are we breaking even? Are we?
We
Keeping our heads
do this
above
really
water.
just to cover our costs. We want to make sure that it's not a cost to the county.
Exactly.
It would probably keep us a little bit further along before those fees catch up on us, so.
When we first took this over from the state, I understood it to be, we don't have to just cover our costs. It's okay to make a bit of a profit off of this. So I'm in favor of bumping up pretty
The
much
real estate
all
one.
of them.
All of it, yep.
Because this, so the county ain't got any money to spend. And we certainly don't want to keep the state from, getting, so if we're going to be, are we going to be making a little extra?
We make a little bit extra on our bacteria, which is our big package. We make,
No, I mean, in the budget as a
in the
whole.
budget as a whole.
Yes.
This will just really have us come out, like on the water section. No, we won't be really making any money. This is just more break even on us.
Why don't we raise them so that we are making a little money?
Well, we can do that. I wasn't, we can do that. I didn't know what the understanding was on starting that program and that we could make a profit on some things.
We're not here to subsidize the state. The state is supposed to subsidize us.
Mhm.
So.
So,
Okay. Go ahead, Julie. You were gonna say
nope,
something?
I was just gonna say, so do I go back, take a look at these, or do you want us to say we wanna be so much ahead of our,
Let's hear from Mr. Van Etten and then we'll see if Dale wants to revise his.
I don't think there's actually a second to my motion. I don't know if you want to have a
that's true.
discussion.
Was that a motion or you were?
I tried to, yeah.
Okay. We have a motion on the floor. Is there a second? Okay, thank you, Deanna. Okay, so now we can continue with the discussion. Chuck, you're up.
Real quick, refresh my memory. Didn't we just do this like a year ago? Was there something we did similar? Where
Yes.
we were raising?
last year we brought it forward just because we knew that our time costs and things had gone up. This year we had to bring it back forward because the shipping contract made a big difference in the cost of shipping.
Okay.
So,
I just didn't know if I thought it was deja vu. Okay.
yep, good memory.
Mr. Chairman, then, in discussion, Dale, you raised the real estate package from 105 to 120. Okay, and then Julie, you had mentioned something about the VA. VA also applies for these or something? Can you explain?
A lot of, when we go and do that rest package, it's usually for a VA loan.
A VA loan.
Mhm. Because they require specific information within a short period of time. So.
What other ones do you think we could bump a little bit? Because prices are going to do nothing but go up.
And we could
Prices
cover,
and-
rather than coming back every year.
Well, yeah, it's quite reasonable to put a percentage of profit on everything, just like a business.
Yep.
Because you're going to have equipment that will need replacing or repair or upgrades. We need to be proactive in having enough money in the coffers to pay for our expenses. So is it better to go through these one by one and talk about how much they should be adjusted, or can we just assign a percentage at this point in time, whatever your costs are across the board, raise it 5%, 10%, something.
To an even number.
Yeah, that's the one thing we did try to adjust for.
I think we can wing through them real quick again.
Okay, so, first one, what I'm gonna do is just tell you what it costs us and what our recommendation is. So, bacteria, $15.65, suggested price, $25. So that one we have some profit on.
That's okay. In the private sector, when a well is drilled, it's costing a lot more than $25 to the customer.
Yeah.
It's, when we did it, and that was over a decade ago, it was $50.
Was it bacteria? So when we
That's what
do
we charge the
bacteria,
customer.
bacteria and nitrate is 50, so that might have been the one
Okay, it's
that you were doing.
bacteria.
Bacteria and nitrate is 50, and it costs us $47.65.
So 60.
60, yeah.
Yeah.
Okay. Nitrate and arsenic individually are hardly ever ordered, but right now nitrate cost us 35. We had charging 35. It's probably not going to get ordered a whole lot, but do you want to go up on that one?
40, 45?
40.
Well, point of order, Mr. Chairman, you have a motion and a second on Mr. Olson's recommendation first.
Oh, yep, and did we do that?
And we haven't voted.
I would be willing to accept a friendly amendment based on discussion.
No, we're still discussing it. That was my understanding. That you
This is
wanted
part
to-
of discussion.
I can,
That this was part of the discussion.
I can wrap my head around that.
And then we make a motion after that? Is that what we do?
No, I would
Accept the
amend
whole
my
thing.
motion.
Okay, to the new prices. Okay, so nitrate, we had cost 35, suggested 35. We were in between 40, 45. I didn't hear a final on that one.
$4.
Okay.
Arsenic costs 42. We have 40 on it, so I'm guessing
More.
45, 50?
Yeah.
45. It's probably not one that's going to get used much, so those don't really impact us as much. The combination package for bacteria nitrate, just to redo, it was $47.65. You guys bumped that to $60. Then real estate package, we're at 103 to get it done, and we recommended 120. Okay. And metals package costs us $72, recommended was $75.
80.
What metals are they testing? for?
Metals are arsenic, calcium, copper, iron, lead, magnesium, manganese, potassium, sodium, sulfate, and zinc.
And we're getting that done now for $70?
$72 is what it will cost us.
Wow, that's,
I know, that's because we switched to Stevens Point,
That's
and they
really-
happen to,
that's
that's their
really cheap.
cash cow, apparently.
That's really cheap.
Okay, so costs or charge.
$100.
Sure. I'm okay with that.
Yeah.
It's a lot of metals.
And do all those prices include the shipping?
Yes,
now? Okay.
yes. Everything's in there, they come. The only thing that wouldn't be is if they had to get a replacement bottle, we just have nominal fees to cover the cost of those bottles, but. Homeowners package is, and this one was bacteria, nitrate, pH, iron, hardness, and alkalinity, just so that you know what's in there. It costs us $54.65. We put 55 on there. 55, so basically cost us 55. We had 55, 65.
I wouldn't raise that one too much because you do want to encourage homeowners to get it done. It's a safety issue. public health
Do you
issue.
want to keep that at 55, just to encourage that one to
I
get
think
used?
60 would be a fair number, and what I do as much water testing as anybody for my houses. And it's nice to just pull 320s out of your wallet and here you go.
Be done. Okay, and then the comprehensive package, that one includes everything that was on this first one, plus the metals. That would have been 117, that cost us 117, 118, and we were saying 120. So do we want to go up?
125.
Up 5 on that one, just okay. So do you want to,
Mr. Chairman, I would like to amend my motion to include the prices we just discussed.
There's a second agree with that?
I'll second.
No.
Carol already did.
Okay,
okay,
any further discussion? Everybody in favor, say aye.
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 Anybody opposed? Motion passed.
excuse me, Chairman. So for when you bring this to the board, what I thought I would do is just put what we charged before, what we're recommending now, take all of this out of here, or do you want all of this information in here to the full county board?
I'd like the new numbers put in there that we
Just-
agreed upon here, and then we're gonna pass this resolution that's approves all those changes.
Yep, do you want all of this information, like, or do you want me to
Oh,
just have the line? have
No,
the
I
whole
think so,
thing?
yes,
Okay, that's
yep.
what I wanted to.
There's enough
validate.
people that are gonna ask questions.
Okay,
Very much. Budget proposed report, we all have that. Just let us recap for the package.
Is Patty online, Chairman?
Patty?
Oh.
I am here.
Yeah.
Okay,
Patty, how are we tracking with our budget? I know we're always behind on this, but like for out-of-county placements and how do you see that?
Okay, well, right now, we are only 1 month in. We're right now paying our February bills and finishing our February. So the report that you have only shows 1 month. And actually, we don't even, the report that you're showing with your purchase service recap is not even showing any out-of-home placements for child welfare or juvenile justice, because we don't pay those until February for January. So it's hard to see anything from 1 month into the year. We have been running high, just like we've been all along. Last year, of course, we came out projecting way overspending in those out-of-home placements for child welfare.
any other questions for Patty? Okay. Future agenda items?
Definitely the bus on there at some point.
Okay.
We won't if it goes.
If the county board passes it, we don't need to.
And while that's true, we still have to approve bids, don't we?
Yeah, at some point, we can get to that.
The resolution going around the sign.
Yep.
Okay, are we done now?
There's a resolution for